and now it's my turn. Well, we have been talking about the same medicine is there. The only reason why homeopathy is being better because we do not go on the name of the disease. We do not give the medicine by the name of the disease. We give the medicine on the patient. That's what we've been talking about, all the individuality. Homeopathy being the only science that weighs the importance of mental symptoms equally to physical symptoms, thus scores over all other medical systems and treatment of motor neuron disease. Now the limitation of conventional management, drugs like Reluzole or Ederon, or the latest what we have been talking about the stem cells. Stem cells is very effective, but not in this particular motor neuron disease cases have been reported to be benefited. Stem cell has been very, very beneficial for lot many other diseases, even like diabetes and all that. I mean, they have been very good results, but not good results have been seen in motor neuron disease. And stem cells being a very, very costly affair, and Reluzole, which again they say that it can hopefully stop or slow down the progression. They have never claimed, but they say that is why you keep on trying. And I was surprised to see the patient from America. The moment they have been diagnosed with ALS or MND, they are left alone. ठीक है जी, अब तो आपको कुछ होना ही नहीं, like they start, going for recreation and all that. आप उनको जितना आराम दे सकते हो वो करो. Physiotherapy is also not being given properly. Homeopathic approach, individualized and holistic approach, stimulates the body's self-healing. That's what we all know. It is safe, gentle, non-toxic, and long-term use. Can complement conventional therapy, where those who were taking Reluzole, they ask, shall we take this medicine or not? Because nobody can give them a guarantee. So it becomes very difficult for them to say, okay, don't take. Suppose I say, don't take them tomorrow, and आपने वो दवाई बंद करा दी थी, तो इसलिए problem हो गया. So I say, if you feel it is being benefiting you, you can carry on. Otherwise, so far, over 1,000 patients are treated of that, and I have seen the best result in those patients who have been totally dependent on homeopathy. Like mathematically, we talk about MND is a combination of all chronic miasms, psoriasis, psychosis, syphilis, resulting into a complex mixed miasm, but predominantly falls into a syphilic miasm. Though the constitutional minimum we have been talking about this morning is a dictum, but as MND is a fast progressing degenerative disease, remedies with regional affinity also are required at times. Like we'll be coming to that point. The moment the patient has been given some, like a system of medicine is not defined by its tools, but the principle and the intention behind using them. You can see them, one side is a homeopathy and the other side is the allopathy. Homeopathy has got an edge in MND treating. Holistic individualization, it slows the progression, it improves the quality of life, mobility, speech, swallowing, and it addresses psychological impact, safe and non-invasive and non-toxic. Clinical research and experiences, case studies improve mobility, speech, swallowing, reduced frequency of scar, research, neuroprotective and immunomodulatory potential, works synergistically with physiotherapy.
What about that anxiety or घबराहट जो था बहुत ज़्यादा?
वो anxiety भी एकदम चला गया है, अभी कमर होता है।
Very good, anxiety बिल्कुल ठीक है, चलो good. अच्छा अब आपको जो कमर
सर ये आगे की तरफ झुकता था, अब नहीं झुकता, हाँ, गिरने का जो डर था ना वो remedies,
वेरी गुड वेरी गुड
कंप्यूटर
ठीक है
ऑपरेटर नहीं हो।
लेकिन चलने में दिक्कत है।
अच्छा क्या दिक्कत हो रही है चलने में
ये थोड़ी क्रेम पानी काफ़ी कम हो गए। ठस का वो 80% मतलब खत्म हो गया।
वेरी गुड
50-60%
चोटी खत्म हो गई
खत्म हो गई।
वेरी गुड
हाथों में थोड़ी वो मसल्स आने लगी।
गुड
पहले एकदम पतले थे। अभी पिछले महीने से नींद भी थोड़ी ठीक आती है।
वेरी गुड
और ये कंधों है ना पीछे कंधों पे वो दर्द काफ़ी कम हो गया।
काफी कम हो गया। जो पहले नेगेटिव थॉट्स आते थे
वो काफ़ी कम हुए इधर
अभी कम हुई अभी भी है मतलब
और पीछे
अच्छा चलो
ये 3 महीने दवा लेने बाद
किन किन किस किस चीज में फर्क है वेट कहाँ नहीं बना
थोड़ी क्रेम पानी काफ़ी कम हो गए।
किन किन किस किस चीज में फर्क
थोड़ी
हाँ नहीं
कम हो गई।
बस बाकी भी है ठीक है
थोड़ी क्रेम पानी काफ़ी
किन किन किस किस चीज में फर्क है हाँ नहीं बनाएंगे दोबारा बताइए क्या 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 वो कैसे पहले से कैसे हैं
वेट गेन हुआ है 1.5 किलो।
1.5 किलो वेट गेन हुआ है वेरी गुड अच्छा और
हाँ कमजोरी भी कम हुआ है।
कमजोरी भी कम नहीं बहुत अच्छी बात
थोड़ा चीज है
ठीक है और जो एंजाइटी घबराहट वगैरह थी वो कैसी है
वो भी थोड़ा कम है।
वो भी कम है वेरी नाइस अब वो जो नेगेटिव थॉट्स आ रहे थे
वो भी कम है थोड़ा।
Now,
हाँ नहीं बनाएंगे
in all these videos, you could see those patients those who were given that there is no treatment and they were absolutely, running into depression and having full of negative thoughts, having anxiety what was going to happen. There used to be fear of walking while walking. There is fear of falling down. They will continuously losing weight and having muscular wasting, which has already been improving by in all these cases. Remedies often which we use like Ostium plumbum, cuprum, arsenic, and selection depends on individual case. Which again, since morning we've been talking about individualized. Homeopathy has a role in MND care, dose progression, and increase the better energy. Moderate stage maintain independence in daily activities. Advanced stage palliative support, reducing suffering. Works with physiotherapy, speech therapy, nutrition and counseling. Patient-centric benefits, safe and cost-effective, sustainable for long term, provides hope and coping ability and enhanced dignity of life. Here you can see with the graph, with this allopathic medicine or this modern medicine, the maximum lifespan could be 3 years. And I'm reminded of a case where the patient was by G.B. Pant Hospital. He was told that he has got only 1.5 years of his life to survive more. He is with me now. It is 16 years that patient is with me, and he is not taking any more medicine. He is completely all right. So now this kind of a thing is in there which has been discouraged. And the best part was, I asked that particular patient of mine to go back to that G.B. Pant Hospital, and you'll be surprised. The doctor was very much happy to see him and said, surprising. And then when he told that I did not take allopathic, I took homeopathy. The worst part was, the doctor said, अगर allopathy में इलाज नहीं है, तो homeopathy में कैसे हो सकता है? Now this is the thing which we need to change, which need to be changed altogether. Conclusion: homeopathy offers unique advantage over conventional medicine, symptomatic relief, slowing down of the progression, arresting the progression, enhancing the quality of life, even complete reversal seen in few cases, which is people are not ready to accept and believe. Integration with multidisciplinary care ensured better outcome and hope. Over the period of 16 years of treating more than 1,000 patients of MND, I have observed that most of these patients are highly principled and oversensitive and in their demeanor, and any kind of any injustice, deceit or grief has been underlying factor traumatic to their constitution, which led to the development of MND. Homeopathy being the only science that weighs the importance of mental symptoms equal to the physical symptoms, thus scores over all other medical systems of treatment for motor neuron disease. Though not claiming definite cure, homeopathy has provided respite to many patients in their persistent and progressive suffering from this dreadful disease and gives ray of hope. Let us put our best effort to put with this gathering in doctors from all over India and these also. Let us put our best effort to put an end to MND next. And from this you can see the patient was brought to me by his father on that. It was 2019. Thank you very much. Thank you.
Thank you, Dr. Gupta. You have gone through the very psychosomatic and somatopsychic aspect of everything. And you have also gone through the comparative study of the medicine of all sorts of the humanity. Thank you very much. So
मैं डॉक्टर बीएन सिंह सर, डॉक्टर कोस्टा, डॉक्टर भाटिया सर से आग्रह करता हूँ कि सर को मोमेंट में सम्मानित करें। डॉक्टर A.K. गुप्ता सर, थैंक यू सर। डॉक्टर प्रभाष श्रीवास्तव प्लीज कम। ये सम्मान है, यही हमारी कीमत है। डॉक्टर संकेत।